Hi everyone, my name is Macy Higgins, and my speech is about the importance of nonverbal communication in the healthcare field. So imagine not being able to show your doctor you're in pain through a grimace on your face or tears in your eyes. And imagine as a healthcare provider not knowing whether or not your patient is lying to you because you can't see these expressions on their face. The way we show each other how we feel without saying anything at all is one of the most important concepts of communication, especially when we're talking about the relationship between a healthcare worker and their patient. By the end of my speech, you will understand the importance of nonverbal signals in a healthcare setting. Nonverbal communication is something that affects all of our lives, whether we are using it in a healthcare setting or just in life in general. And in order to better connect with those who we are trying to help or help someone else in need, we need to recognize and understand nonverbal signs of communication. In order to fully understand the ways in which someone is speaking to us without saying anything, we first need to identify the types of nonverbal communication, learn how to recognize and comprehend nonverbal communication, and lastly, understand the importance of nonverbal communication in a healthcare setting. According to the 2019 article Nonverbal Communication, psychologists Jan Segall and Melinda Smith found that there are 7 commonly used types of nonverbal communication in the healthcare field. These 7 types are facial expressions, posture, gestures, eye contact, touch, space, and voice. Each of these, whether combined or just used on their own, play a part in how we analyze the people we speak to. Segall and Smith also found in their 2019 article that each of these 7 forms of communication can also play 5 significant roles. The first role is repetition. Using a form of nonverbal communication, such as a gesture, multiple times strengthens the point you are trying to make, and contradiction is the opposite. It finds that gestures, posture, and other forms of nonverbal communication you use go against what you're saying verbally. People often do this when they are lying. Substitution, the third role, is related to facial expressions and how we use them to replace the words we use to show how we feel about something. And the last 2 roles, complementing and accenting, use movements to accentuate what we were saying. Now that I've discussed the types of nonverbal communication, let me move on to my next point, which is understanding nonverbal communication. In their book, Application of Nonverbal Communication, written in 2005, Ronald Riggio and Robert Feldman claim the following: health and illness are complex, socially influenced concepts, and understanding them rely heavily on communication. So people who work in a healthcare setting find that nonverbal communication is essential, considering it can reveal the truth about a patient's symptoms and how long they have been experiencing them. In order to accurately and successfully treat a patient, a healthcare provider needs truthful and detailed information from the person who is experiencing those symptoms. Patients tend to conceal the truth for a variety of reasons, whether it be embarrassment, confusion, fear, or anxiety. It is important that a healthcare provider be watching for the subtle changes in expression in order to show whether their patient is telling the truth or covering up how they really feel. Another paragraph in Riggio and Feldman's 2005 Application of Nonverbal Communication states that a physician's nonverbal communication is also extremely important when helping a patient understand their situation. Due to the inferiority felt by a patient when they are speaking to their doctors, patients often pay close attention to their patient's nonverbal signs of communications as well. It is important that a provider be calm and attentive in all forms of nonverbal communication in order to show that the patient that they are listening and that they care about their well-being. Providers who do not do this put off signals that they don't care about how the patient's feeling, they don't care about their input, and they are only going to do what they think is best. Now that I have discussed how to understand nonverbal communication, let me move on to my next point, which is why it is so important. Moy Ali, the former vice president of the Nursing and Midwifery Council, states in her article, Communication Skills, Nonverbal Communication, written in 2018, found that how a nurse presents themselves through nonverbal communication is detrimental to how a relationship will form between them and their patient. I like this quote. It says, "The nurse who stands when a patient enters a room and steps forward with a welcoming smile is in stark contrast to the colleague who remains behind a desk looking at the patient's notes." This quote shows how simply standing up when a patient enters the room will affect the rest of the experience with your patient as time goes on. A patient will feel more comfort in your presence if you are warm and welcoming, and oftentimes give you the information you need to do your job. In 2005, Ronald Riggio and Robert Feldman also stated in their book that applications of nonverbal communication that learning the interpersonal behaviors often shown by healthcare providers is essential in the relationships between the patient and provider. When a patient is more trustworthy of the provider, it is more likely that they will make a recovery because they will be more willing to participate in their treatment and truly believe that it will work. Involving yourself as a healthcare provider in a patient's care, both verbally and nonverbally, is what it takes to get the results that both you and the patient need. Without nonverbal forms of communication in the healthcare field that I have proven significant, there would be an extreme disconnect between patients and their healthcare providers. So let's review. Understanding and knowing how important facial expressions, posture, gestures, eye contact, touch, and space and voice truly are to the healthcare field and how they work in a patient-provider relationship is essential to anyone planning on working in this field or trying to communicate with their provider. The healthcare provider and patient relationship is one of the most complex in society. Putting your full trust into someone and being fully trusted is not a relationship that is commonly found outside of the healthcare field. Nonverbal communication is only one piece of the very large puzzle of this relationship, but in some ways it is also the most important. So this is my works cited, and that's all I have for you guys. Thank you guys for listening.